Our government does not believe that supervised consumption sites at LRT stations is an appropriate solution. However, if the city councilor or the city council does believe that it is the appropriate path forward, then there is a process for that.
It all started with a tweet, a call for more public transit safety and criticism of the provincial government's handling of supervised consumption sites, ultimately leading to online barbs being traded, highlighting the tension around the issue. Calgary City Councilor Courtney Penner tweeted, "At a time when people are crying for more transit safety, the province is making it harder for those seeking supervised consumption to get care." Alberta's Associate Minister of Mental Health and Addictions firing back, saying if the city wants to turn train stations into supervised consumption sites, they can fill out an application. He then posted the link on how to do so. Doubling down on that answer in an interview with City News, he tells us the response was out of frustration.
We certainly support the expanding of overdose prevention sites in Calgary, and we're hearing from the operators that it's actually the city that has been slow in the approval around this process.
Ellis says the city needs to pick up the pace, make sure the 2 new sites proposed at Alpha House and the Drop-In Centre get built, as the plan is for those 2 to replace the current supervised consumption site at the Sheldon Schumer. But Councillor Courtney Penner says finger-pointing doesn't help, despite her pointing fingers at the province in a tweet on May 10th.
I think pointing fingers isn't going to get us anywhere. And as if we point fingers and we lay blame, we're not really truly getting to solving the issue and supporting the individuals who need help. We need a partnership. Our doors are open and we're willing to have that conversation.
To be fair, though, you did point fingers at the province, right, on May 10th?
To be fair, you're right that we need, and when we look at the jurisdictional and operational mandates, yes, we did say that the province is not making it easier. I did say that.
Self-described Albertan in recovery and former staffer to the Associate Minister of Mental Health and Addiction, Sheldon Bailey, says the government should focus on helping people using supervised consumption sites get into treatment and recovery instead of building more sites.
People with addiction don't want to be supervised. My addiction took place, inside the 4 walls of my home. And the majority of people actually overdosing and dying in this province are doing so in a private residence or own home.
In Edmonton, Safe Kaiser, City News.